Music training increases phonological awareness and reading skills in developmental dyslexia, a randomized controlled trial. Dyslexia is a developmental learning disability that affects an individual's spelling and reading despite the individual having a normal intelligence level and receiving a quality education. This disability occurs without overt sensory or neurological damage. Especially in adolescence, an individual who suffers from dyslexia is at an increased risk for internalized issues such as anxiety. Many believe dyslexia could be related to impaired temporal processing. Researchers have hypothesized that specific amplitude modulations of 2 Hz to 50 Hz may produce optimal acoustic foundations for speech rhythm and syllable rate. Counter-research has shown deficits were detected at slow rates of 4 Hz, intermediate rates of 10 Hz, and fast rates of 500 Hz, suggesting there may not be an exact temporal scale where all deficits are eliminated. There is overwhelming evidence that music training changes the function and structure of the auditory and sensory motor systems, which increases performance in music-related tasks. Music abilities are intertwined with cognitive functions in various domains. Studies have shown that musically trained children show higher reading and vocabulary abilities and are better at detecting pitch changes in speech. Musically trained children also show more proficient verbal intelligence compared to the children who had no music training. To support the view that music training affects both speech and language processing, recent evidence has shown that musicians' brainstems process more linguistic sounds compared to non-musicians. Musicians have enhanced activation in their auditory cortex when listening to music or speech compared to non-musicians. A recent hypothesis that may help explain the musicians' link to language would be the precise auditory timing hypothesis, or PATH. This hypothesis states the musician's expert phonological abilities leads to precision in auditory motor timing required by music, potentially causing more precise and expert timing of speech sounds. The current study was a prospective, multi-center, open randomized control trial. The general hypothesis of the study is that music training improves temporal processing at different time scales in children with severe dyslexia, helping their reading abilities and phonological awareness. The participants in the study were children living in Italy, ages 8 through 11, who had been diagnosed with severe dyslexia. Out of the 225 children with an eligible dyslexia diagnosis, only 46 were eligible for the study. The other children were excluded due to comorbidity or lack of meeting intellectual requirements. The participants were assigned to one of 2 groups, a music group or a painting group. All of the participants took classes for their respective groups for 2 hours a week over a course of 7 months. All of the children were tested prior to the classes and then retested after the classes on 11 neuropsychological measures. There were 11 neuropsychological measures that included tasks the participants were asked to perform. These tasks included general cognitive abilities, phonological awareness, reading abilities, self-esteem, phonemic blending, phonemic segmentation, MLP rise time, MLP temporal anisochrony, tapping, rhythmic reproduction, and perception of musical meter. These are the variables measured in some of the tests that are more complicated and less self-explanatory. General cognitive abilities were measured with working memory of the participant. Phonological awareness was measured by testing participants' ability to read pseudo-words or non-words. The phonemic blending task is a task which involves giving participants a list of nouns that increase in difficulty and ask them to accurately blend the words together. An example of this would be to give the participants the letters CAT and ask them to state the correct word given from the letters. Phonemic segmentation is very similar to phonemic blending, but in reverse. Participants were given a list of nouns that increase in difficulty and asked to break up or segment the words. An example of this would be taking the word cat and separating each letter, C-A-T. MLP rise time is a procedure that has participants listen to 5 tones and attempt to accurately detect the longest tone. The participants were tested on the outcome variables, which were the results from the neuropsychological measures. These are the primary and secondary variables that researchers use to compare the painting group and the music group. The primary variable was the performance in pseudo-word reading test measured in terms of accuracy. The secondary variables include a pseudo-word reading test measured in terms of speed, reading words and text measured in terms of accuracy and speed, phonological knowledge or phonemic blending measured in number of correct answers, auditory attention measured in accuracy, verbal short-term memory and working memory, and temporal processing through rhythmic reproduction task, tapping task, and temporal anisochrony threshold. The statistical analysis used for the study was a 2-stepwise multiple regression analysis. The results show the music group outperformed the painting group in the text reading and reading of pseudo-words and accuracy. Children in the music group performed better in the phonemic blending task and showed greater improvement in working memory than the painting group. There was no difference in the reading speed between the two groups, and there was no apparent difference in either level of verbal comprehension or self-esteem levels between the two groups. The benefits of music training became evident when testing auditory attention, perception, and production abilities that were tested by musical tasks. These tasks were significant because they required precise temporal processing. Figure 2 shows the average scores for the children in the painting and music group for the phonemic blending and rhythmic reproduction tasks. The left plot shows the music group produced more accurate results in the phonemic blending task than the painting group did. The right plot shows the music group produced more accurate results in the rhythmic reproduction task than the painting group. This suggests that music training in dyslexia children has the potential to improve temporal processing tasks related to both music and language. Figure 3 presents a scatter plot of the improvement in both the rhythmic reproduction task and the phonemic blending task between both groups. Much like Figure 2, the scatter plot shows the music group outperformed the painting group. The greater improvement in phonemic blending tasks indicate the music group has greater improvements in rhythmic abilities and phonological awareness. The major limitation of the study was high comorbidity rates among the children with an eligible dyslexia diagnosis. It can be extremely hard to find a group of participants that meet so many specific requirements in such a young age group. Neither group showed improvement in the task measuring perception of musical meter. Though the groups did not vary in performance, both painting and music groups significantly improved in tapping skills and rise time detection. The results show the music group outperformed the painting group in the text reading and reading pseudo-words and accuracy, phonemic blending, phonemic segmentation, rhythmic reproduction, temporal anisochrony, and showed a greater working memory. There were no apparent differences in either level of verbal comprehension, reading speed, self-esteem levels, tapping skills, rise time detection, or perception of musical meter between the two groups. The study results showed the best predictor for phonological awareness is rhythmic reproduction and not working memory. The researchers credited this to the fact that rhythmic reproduction task was the most complex task they assessed, providing them the greatest insight to temporal processing. Rhythmic reproduction improvements was a good predictor for improvements in phonological abilities, supporting the hypothesis that there is a causal relationship between rhythmic-based processing and language acquisition. The findings of the study support the hypothesis that music training can be beneficial on rhythmic abilities and phonological awareness, especially in children with severe dyslexia.